So it's Ryan McGuire here, the founder of Upward Care, and we're here with Marie, our lead instructor at Upward Care as well. So we really wanted to kind of take today to give you an opportunity to meet Marie. For those that'll be engaging in kind of the education that we provide, you'll have an opportunity to work with Marie very closely. So we're excited about that and excited to get started. I'll first kind of give an overview of what we do at Upward Care, just in a general sense. So we provide family caregiver training, primarily focused on hands-on skills. So we have 4 modules now at this time where we focus on bedbound care. We have a module on Hoyer lift operation. We have a module on transfers, and then just a general education module. And so, really when we created Upward Care is, with the vision of better supporting families. We know, resources for family caregivers can be somewhat limited, and oftentimes with really no preparation in education and in preparing families for the responsibility that they'll be having with the care of their loved one. So, that's kind of the idea behind Upward Care. But we're also really focused on being a resource for, any family, kind of steering them in the right direction and hopefully improving their overall experience. So, anyways, we're excited to have Marie on board. And so why don't I just give Marie an opportunity? Why don't you introduce yourself, just maybe kind of a quick background and how you got into nursing.
Well, thank you so much, Ryan, and thank you so much, Upward Care, for having me with you as not only an employee, but also as a kind of an extended family member that will be coming into your home, and I'm going to be helping you gain independence. And I want you to feel security, and I think education is key. So again, my name is Marie, and I am a Bachelor of Science trained nurse. I was also an educator for over 8 years. I have multiple experiences from taking care of tiny little babies in a neonatal intensive care unit, to taking care of children, to adults, to teenagers, to our mature golden year population. I have all kinds of different experiences, including psychiatric care, and I also teach. I teach at a local college, all kinds of wonderful skills, a lot of the things that I will be coming into your home and helping you learn. And so that's just a little bit about me. Okay, one more thing. Yeah. I graduated from Rutgers School of Nursing in New Jersey, and actually was born in Texas, and here I am. It's come full circle.
Yeah, that's fantastic. One of the things I really liked about your background is, when we were getting to know each other originally, is the passion you have for education, being an educator, really to start your career, then going back to nursing, and then quickly finding your way to education and nursing. So maybe just real quickly, why are you so passionate about teaching and working with families?
Well, I actually didn't even add that I have a master's degree in instructional design.
Oh, okay. Yeah.
So that is actually an addition to the package you'll get with me. I love education. It's great to be able to know how to bring together curriculum, but also how to teach people how to learn. And I think at a very basic level, how do people learn? What do they need to learn? And so those are the things that just encourage me, give me passion. I really want to give independence to the family caregivers and the care recipients as they go through, and we are going to progress together in a journey. This is growth together.
Yeah, absolutely. That's I think that's so good. Such beneficial experiences for family caregivers, having somebody that has a background of actually teaching, number one, but then actually teaching nursing curriculum to your future LVNs and nursing students, RNs. And it's just invaluable for for the families, and the attention that they'll be getting one-on-one. Like, this is how you actually
Right.
care for your loved one. So it's exciting. So what made you kind of switch your career path? You originally, you were strictly education, and then you went over to nursing. What were your thoughts and goals kind of behind that?
You know, it is kind of different, right? It is kind of a switch, but I don't think it's completely that different. I think I'm still encouraging people. I still think that I'm there helping them, teaching them how to care for themselves in their best way possible, whether it was in a classroom or whether it's going to be with a patient. It's still that devoted attention, that need for feeling important. Each one of us needs that. We need to have that positive encouragement to be able to succeed. And I think whether you're a teacher or you're a nurse, you're still giving those things. You know, you are still, and your recipient still needs those things from you. You have to understand a process. Whether
Yeah.
I'm teaching you to write or read or do art, or if I'm teaching you how to take care of your loved ones, movements from in and out of a bed, how to make sure that they're safe. You still need to be taught these things, whether it's nursing or teaching. I think it's integrated very nicely.
Yeah.
And I still have care plans, regardless of what type of job I do. And
Yeah.
I make these plans because I need to make sure that it's a written process that we both understand, and that you can, you know, follow this process to get to where you need to be successful. And
Yeah.
as happy and safe as you can be with your family member.
Yeah, absolutely. I think you know, that's a great expectation. I think it's comforting for families to know there's you know, when you get services and you get training education through Upward Care, there's a lot of thought and planning that goes into the curriculum.
Yes.
And there's reason behind why we start off with communication, and why we then moved into like demonstration of hands-on skills. And so having your experience in education is really important to you know, understanding those objectives. I think, you know, there's a lot of nurses and other healthcare professionals, they know how to do things hands-on. This is what their profession is. But having the expertise in curriculum development and teaching are things that are just very critical in the overall experience for families and being beneficial for them. So, yeah, it's been really good to get to know you on kind of the background and your philosophy and education. We wanted to kind of take the next few minutes to answer a lot of the questions that we've had from families, either in a workshop or whatever it may be, coming in through the website at upwardhealthcare.com. And so we'll kind of just ask those for Marie and give her an opportunity to answer them. And so we'll go ahead and get started. You know, one of the things we've really started off with in the transfer section is just the use of a gait belt. And we know, you know, sometimes gait belts are inconvenient and you need it in this room, and it always happens to be on the other side of the house. But it's super simple and inexpensive safety device, and really important. And Marie, would you mind just taking a second to explain the importance of it, why we emphasize it, and kind of put a point of emphasis on the gait belt?
So it's just so important that as a care recipient, you build trust, right? As a caregiver, that you give trust.
Yeah.
And the best way to have that is with the devices that we use. They wouldn't have been invented if they weren't that important, right? We need to use something that has been tested. The experts know all about it. They've written 1,000 articles about it. So it's something we just got to do. And it's something that's safe. Not only is it safe to your care recipient, but it's safe to you, the caregiver. You want to keep your body as strong as possible for as long as possible. Because if you're not strong and you're not able to care for yourself, how are you able to care for your care recipient, right? And we need to be there for ourselves, right? So let's go ahead and take that time. If it's 5 seconds, it's 10 seconds. A second matters. Seconds matter. Let's go ahead. Let's breathe, right? And let's take that time to say, you know what, let's do this the right way, right?
Yeah.
Let's do it the safe way. Let's go grab the belt, right?
Yeah.
And let's put it on correctly and make sure that you're protecting yourself and your loved one.
Yeah.
Yeah.
Yeah, absolutely. I mean, we've had so many people kind of share that have participated in the workshops, and they said, we've been transferring our loved one for years and have really never even been shown how to use a gait belt. But really, after the workshop, they're like, this facilitates much better body mechanics. I feel like my body's in a better position. I have something to grasp onto during the transfer.
And, and excuse me if I don't mean to interrupt, but if your loved one starts to pass out on you, is grabbing their t-shirt, which is loose, really going to hold them up? How are you going to, right?
Yeah.
So don't we need something more solid, something that's actually snug around the waist, right? Something that's actually grippable. And so if they do pass out, or heaven forbid something should happen, or they trip, their balance is off, but that gait belt, you just hold on tight and you position your arm in the correct spot and your other arm around the other side of your significant, your loved one, your recipient, okay? And you hold on to them and you create the balance for them. Yeah. And so now if they're unsteady or unbalanced in any way, shape, or form, you got them. You got them. You got this.
Yeah, absolutely. Very good. So that's, just a point of emphasis for us during the transfer process, using the gait belt, using proper equipment. We also get a lot of questions, especially when it's in bed down care, about the importance of privacy and dignity. Can you talk a little bit about that, and really from a care recipient's perspective?
So a care recipient, right?
Yeah.
This is a new role. Whatever we're transitioning into, most people don't receive care. Most people just take care of themselves. They've done it for years and years and years. And now all of a sudden the roles changed, right? And we've always had this sense of privacy and dignity. And now sometimes overnight it can be taken away. But we don't want to feel like that. We don't want to have that happen to us. We still need privacy. Our caregiver may be a family member. They may be the most intimate person that we've ever had in our life. They know us inside and out, but we still need privacy, because the things that we would do in private would be done privately, regardless of that relationship with them. That's closed door of the toilet. You see that? The bathroom door would be shut. The shower curtain would be pulled. These are still things where we want that sense of privacy. And so now if we have somebody who's taking care of us, we would like to still be able to have that. So let's go ahead and give the care recipient, give us, right, that privacy sheet cover. If we're getting a bed bath, we still would like warmth and cover, a little privacy. We would still like to be able to go to the restroom and then have our caregiver give us some privacy, right? Maybe halfway close the door, just stand outside. Just all we have to say is, are you okay in there? Just let me know. Oh no, I'm fine. You can say, well, I'm fine. Thank you so much. But that's a lot of respect. And we may be that much intimate. We've been intimate our whole lives. But it's so important for me as a care recipient to feel like I'm in control of me and my body, and that I have the privacy and the respect to keep it. Yeah.
I think that's so important. And I think you touched on something that a lot of people can relate to, is the changing roles. So a lot of times we see a husband and spouse, or husband and wife are now the care recipient and caregiver, or a mother and father and a son and daughter type of relationship. So there's a changing roles. And having the respect while you're providing the care really allows people to maintain their dignity and any independence that they can as well. So definitely it'll improve the overall experience for everybody when we recognize that and provide a respectful environment, like you say.
Yeah. And just providing information to the recipient. If I were a recipient, I'd want to know what's happening to me, right? What are the plans for me? How can I negotiate and communicate what makes me happy? Because I should feel like I have a sense of what's going on with my own body.
Yeah.
Yeah.
Yeah, and I mean, we see a lot of time people are resistant to bed bath. I mean, especially if they're dealing with like dementia or Alzheimer's, and resistant to bathing in general. And maybe you've kind of touched on it in some strategies, but are there ways to kind of overcome the resistance to bed baths, or what's your usual approach?
So what I've learned from my experience in nursing is that a lot of activities of daily living, which would be bathing, dressing, things like that, they're always done by ourselves, mostly by ourselves. And one of the most comforting, luxurious things that we do for ourselves, and I can speak as a woman, but one of the most wonderful things that we do is we may have that wonderful scented candle. We have a spa moment. And I call it a spa moment. I'm having a spa moment. I'm going to put the bath bubbles on. I may have that wonderful, it can be a fireless candle, okay, if we want to talk safety, but we can still have a wonderful, and it's in our own house, and the carpet that we like, and the dimmed lights if we like it, the smell, the shower shampoo, the things that we enjoy, okay? It should be a spa moment. And that's how it's approached. Would you like to have a spa moment? Would you like to have, just your time for yourself? Yeah. We can play some music. We can make this relaxing, because sometimes bathing has to fit into a schedule. It does, right? Yeah. I mean, we have to have the time to take the loved one to the bathroom and get them bathed. And then, so make it a luxurious moment. Make it, something special. Second, how much can the care recipient do on their own? Yeah. And can they mimic what you do? Because, there are things that you may be able to do. One care recipient, maybe I can wash my own hair. I can take the shower hose. I sit in a shower chair. So appropriate equipment would be good, with the appropriate safety bars around you, just in case you would like your privacy, right? So you can be kind of left a bit. Shower with your own showering device, and then being able to rinse yourself off and wash yourself appropriately on your own with the own soaps that you love. Yeah. Right? Those are some things that help. It's autonomy. It's independence. It's saying, I can do this. I used to be able to do this, or I am gaining the muscle strength by doing it, allowing me to get better at it. So maybe I'm not washing like I used to, but boy, I'm going to get there if you just watch me get stronger. Yeah. And challenge myself to get there, Yeah. And it's encouraging to be so independent. When they're done and then they say the recipient, okay, that's good communication again. I would like to have help toweling off. I would love to have that time for you to come in and help me. Do you need to kind of give a little privacy while you towel, right? Or are you comfortable? Can you just come in and give me a towel, right? You have these discussions. And then as the person can take care of themselves, boy, that independence grows. If they are, for any reason, forgetting how to take care of themselves, remember, you can always mimic. This is how we wash. Mm-hmm. This is how we shower. This is how we rinse. And success does not have to come at the level at which we, the caregiver, are viewing. Success could be, I've washed my most vulnerable areas. I've gotten my shampoo. I've done a quick rinse, right? And I'm good, okay? So now I'm okay, and I can take a little time. I can have different milestones in even bathing and showering, right? And then as I can take a little time, maybe breathe and recover a little bit, then I can go for my other vulnerable areas that must really be clean for sanitary reasons. But if I do it just, I'm trying my best, get some soap in there, really wash everything out, I'm successful. I really am successful because I am actively working on doing it. It may not be what the caregiver 100% sees, but we're working on getting to that point.
Yeah.
We are working towards that.
Yeah, absolutely. So, really look for ways to make them more comfortable, and then look for ways to empower the care recipient to take more ownership of it,
Right.
to keep them engaged and feel like they're,
What
giving
really,
them respect and dignity. Yeah.
what are the realistic expectations?
Yeah. Yeah, exactly. Yeah, don't set the standard as, as your normal bathing practices. That's not a requirement for hygiene and sanitation.
Yeah. And you know what? You can always communicate that you feel as a caregiver that you would like something done. But remember, you're always compromising, you're coming to that middle, and it's encouraging the other one. It's encouraging everyone on both sides to feel like they're both being heard.
Yeah.
Yeah. And yeah, it's a relationship you're building.
Okay. Very good. Very good. Yeah, I think the relationship piece is, really good. It ties into a lot of the communication, changing relationships, and okay, so it's really like a trust factor between the care recipient and the caregiver. All right, well, let's talk about bed sores. It's another topic that comes up a lot, especially when our loved ones are bed bound, or they're not getting up as much out of bed. So what are some things to look for just in general, when maybe bed sores are starting to form, or what should we look for, in that sense?
Right. So your whole body, right, has blood in it. And the blood is basically highways from up to down. Your whole body has these blood systems. They're highways. And if you lay somebody down for an extended period of time, greater than 2 hours, any of the bonier areas in their body is going to literally block a highway. And if you're starting to back up traffic, you know what happens. It's not good. So we really need to look for signs and symptoms that maybe somebody's been laying in one spot for too long, and too long is greater than 2 hours. So some things that we need to do to make sure that they don't have those blockings of those highways where all that healthy blood needs to be flowing, right? We need to turn have a look at my hands here. So if this is a person, okay, we need to be moving our person every 2 hours one way. They stay like this for 2 hours. We're going to place some pillows right under here, okay? And then what we do is after 2 hours, we take the pillows out, we place the person down in the middle, okay? That's for 2 hours. And then we take the other side, we gently place them on this side. After 2 hours, we place the pillow, okay? And so all day long, every 2 hours, we just need to do this.
Yeah.
And gently rotate our care recipient. And the reason why is, again, if this is the body, if any one of these bony areas blocks the highway, we end up with something that if we've turned the body, we would flip it, we would see little pink non-blanchable areas. And if you can get any closer, let me see if I can show you on my skin. I would actually see how I get white?
Yeah.
Like that. But that doesn't turn white in somebody whose highways are blocked. And that poor highway right there is all backed up, and they're going to get something called a bed sore. Yeah. And those bed sores, they only get well, let's be optimistic. They can get better with flipping and placing lotion on our care recipient, okay? Or they could get worse. If we don't move our care recipient, that little sore turns pink, and then opens into looking like a blister. Then it opens up even further and further, and then eventually goes down to bone. And so, we can prevent that. We really can.
Absolutely.
Yeah.
Okay, very good. That's great. I think we've had a good opportunity today to kind of meet you, Marie, and kind of go over some questions that a lot of families have, and some of the topics that we'll kind of be addressing when you get some caregiver education from Upward Care. So I just want to thank you for your time and really appreciated having you.
Yeah. And I want to add this too, just real quick. There's
Yeah, of
so,
course.
what the beautiful thing about having an educator come into your home is it's in the comfort of your home. All right. I'm a guest in your home. And I want you to have all of the tools. I have a lot of things that I've learned, a lot over the years, multiple positions.
Yeah.
But I mean, that gait belt, there are so many little different ways that I could help you place it on your loved one, place it depending upon their condition. And it's never just one, one size fits all solutions to everything. And Upward Care has some really great curriculum that really does explain, if this, then we can do that. And so it's that personalized touch of, me being able to come in and say, oh, okay, well, we can work it. We can do this
Yeah.
and we can make it happen. That's all right. You got this. And I'll help you get there. Yeah.
Excellent. Well, that's so good. Thank you so much, Marie, and we'll talk to you soon.
Thank you so much. Have a wonderful day. Goodbye.